The aldosterone test is a specialized medical procedure designed to measure the amount of aldosterone, often abbreviated as ALD, in either your blood or urine. Aldosterone is a vital hormone produced by your adrenal glands, which are two small organs located just above your kidneys. The primary role of aldosterone is to help regulate your blood pressure by maintaining a delicate balance between two key electrolytes in your body, sodium and potassium. When your blood pressure drops to a level that is too low, aldosterone signals your kidneys to retain more sodium in your bloodstream and release potassium into your urine. This retention of sodium helps your body hold onto water, which increases the volume of your blood, and, as a result, raises your blood pressure back to a normal, healthy level. Conversely, when your blood pressure returns to normal, the production of aldosterone decreases, maintaining balance within your body. Abnormal levels of aldosterone can have significant health consequences. Elevated aldosterone, known as hyperaldosteronism, can lead to high blood pressure that is often difficult to control with standard medications. On the other hand, low levels of aldosterone, referred to as hypoaldosteronism, can cause low blood pressure, muscle weakness, and disturbances in the balance of sodium and potassium that may impact your heart, kidneys, and other organs. The aldosterone test is frequently performed in conjunction with a renin test, which measures the level of renin, a hormone produced by your kidneys when blood pressure drops. Together, these tests form what is known as the aldosterone-renin ratio. This ratio helps healthcare providers determine whether abnormal aldosterone levels are due to problems with the adrenal glands themselves, or if another part of the body, such as the kidneys, is contributing to the imbalance. There are several scenarios in which an aldosterone test is particularly useful. It is most commonly used to investigate the cause of high blood pressure that is associated with low potassium levels, does not respond well to conventional blood pressure treatments, or develops at a young age. The test also helps diagnose disorders of the adrenal glands, assess unexplained abnormalities in sodium or potassium levels, and identify the cause of orthostatic hypotension, a form of low blood pressure that causes dizziness when standing up. You might be asked to undergo an aldosterone test if you exhibit symptoms suggesting either too much or too little aldosterone. Signs of hyperaldosteronism, or excessively high aldosterone, include persistent high blood pressure, low potassium and/or high sodium levels. As detected by laboratory tests, muscle weakness or cramps, fatigue, headaches, irregular heart rhythms, arrhythmia, and increased thirst and urination. Conversely, symptoms of hypoaldosteronism or aldosterone deficiency can include low blood pressure, high potassium, and/or low sodium test results, fatigue, muscle weakness, loss of appetite, weight loss, and abdominal pain. The test itself can be performed using either a blood or urine sample. For a blood test, a healthcare professional will insert a small needle into a vein, typically in your arm, and collect a small amount of blood into a tube. The process is quick, usually taking less than 5 minutes, and you may experience a minor sting or discomfort at the site of the needle. For the urine test, you will be asked to collect all your urine over a 24-hour period in a provided container, following specific instructions from your healthcare provider. This often involves discarding your first urination, recording the time, and then collecting all urine for the next 24 hours, including the final sample at the end of the collection window. The container must be stored in a refrigerator or cooler during this period and returned to the laboratory or your provider's office when complete. The amount of aldosterone in your blood can vary depending on your position, standing or lying down. Therefore, you may be asked to remain in a certain position for a specified period before the test, or you might be tested in both positions to ensure accurate results. Preparing for an aldosterone test requires careful adherence to your provider's instructions. You may be advised to stop taking certain medications, including over-the-counter drugs, before the test, as these can influence your aldosterone levels. However, do not discontinue any prescribed medication without explicit instructions from your healthcare provider. Additionally, you may be asked to limit your salt intake for about 2 weeks before the test. Reducing sodium in your diet helps avoid misleading test results. Your healthcare provider will give you detailed guidance on how to do this. It is also important not to consume natural black licorice during this time, as it contains substances that can interfere with aldosterone production and skew your test results. While most licorice products in the United States do not contain natural licorice, it is still recommended to check ingredient labels if you consume licorice regularly. In terms of safety, the aldosterone test is considered very low risk. For blood tests, you may experience slight pain or bruising where the needle was inserted, but these symptoms are typically mild and resolve quickly. Urine tests carry no known risks. Interpreting the results of your aldosterone test requires the expertise of your healthcare provider, who will consider your overall health, symptoms, and the results of any accompanying tests, such as the renin test. Abnormal aldosterone levels can indicate a variety of health conditions, including disorders of the adrenal glands or kidneys, and may require further investigation or treatment. In summary, the aldosterone test is a crucial diagnostic tool that helps healthcare providers assess how well your adrenal glands are functioning and whether your body is properly regulating blood pressure and electrolyte balance. By understanding your aldosterone levels, medical professionals can detect underlying health problems early, guide appropriate therapy, and help you maintain optimal health. If you experience symptoms related to blood pressure or electrolyte imbalance, or if your provider suspects an issue with your adrenal glands, the aldosterone test may be an important step in your diagnostic journey. Remember to follow all preparation instructions carefully and consult with your healthcare team regarding any questions or concerns you may have about the test or your results.